Okay, so good morning everyone. For today's topic, we will discuss about cell blocks. So cell block, this is to process body fluids as cell block for microscopic examinations. Materials from fluids of the body may be examined either by smear techniques or by preparation of tissue blocks to maximize detection of the neoplastic, inflammatory, and/or infectious lesions in the body fluids and other tissue juices. So this is a method wherein fluids undergo preparation before actual embedding in paraffin. So for the specimens used, we have different types of fluids. So we have the fine needle aspiration cytology or the FNAC, and then the fine needle aspiration biopsy or the FNAB. Usually you get this from your breast or the thyroid. Next we have the sputum, the urine, the effusion fluids. We have the pleural, pericardial, and the synovial fluids. And we also have the lavages and the washings. So in the laboratory, we have to emphasize on identity verification. So proper ID on both specimen and requisition forms, the date and time collected, the unique identifier or the laboratory number, the specimen source, and then submitting physician signature. So all of this must match sa patient's requisition form and also the specimen. So specimen handling, specimen adequacy assessment, you should know when to reject the specimen. So primarily, improper labeling is already one reason for a rejection. So universal precautions, of course, you should treat all samples as infectious. Always wear PPE when handling specimens. So for the gross examination or gross description of the specimen, you have to notify the volume. So for example, let's say it's 45 ml. You have to note this on the requisition form. We have the transparency. It can be clear, cloudy, hazy. And then the color. For example, we have amber. Extras. You can put extras if brush tip identified. Also in the laboratory, you have to identify if there is presence of coagulum or no presence of coagulum at all. Okay, so for your cytopathology, since these are all liquid specimens, we have 4 sample preparation techniques. We have direct smears, liquid-based preparation, the thin prep or the sure path, the cytospins, and then the cell block. So we will go over the direct smears, the first 3, but we will be more in depth with the cell block because that's our discussion for today. Okay, so we have the thin preparation. First, you have the collection of the sample, and then you concentrate using centrifugation for 10 minutes. Number 3, you pour off the supernatant, and then you resuspend the cell pellet. 4, you add an appropriate amount of specimen to preservative solution vial. And then 5th, you run the sample on a ThinPrep 2000 processor using sequence 2 or ThinPrep 5000 processor using sequence non-gynecological. So this is an example of microscopic use of a specimen using the thin preparation in comparison with the cell block and the direct smears. So next we have the sure path non-gynecological preparation. So first, all you need to do is you combine into 150 ml tube, and then second step, it is already an automated sample transfer, centrifugation, aspiration, and decanting for cytology preparation. And then third, run on the BD Totalist slide prep. So the difference with SurePath is that it is already automated. So we have another microscopic examination of a slide prepared using the SurePath, and then one with the cell block. Now we go to cell blocking. So cell block is introduced in 1896 using colloidine embedding medium. It is accepted in 1940s. The cell block techniques have already evolved, basic protocol similar in all techniques. So cell blocks are cytologic preparations that are processed as paraffin-embedded blocks in a manner comparable to formalin-fixed paraffin-embedded tissue in surgical pathology. Application. This protocol can be used on any non-gynecologic specimen. Most commonly, we have the serous effusions, the pelvic or abdominal washes, your fine needle aspirations, the FNAC or FNAP, and then your liquid-based specimens like your urine, your sputum. Okay, so procedure for cell block should be applied if there is visible sediment after being centrifuged. Cell block prepared for IHC and molecular studies. So the effectiveness of cell block technique. So one of the constraints of the conventional FNA smear or fine needle aspiration smear is the limited material available for adjuvant diagnostic investigations, including immunocytochemistry. So cell block techniques employs the retrieval of small tissue fragments from a fine needle aspiration specimen, which are processed to form a paraffin block. It is widely accepted that cell block technique increases the cellular yield and improves diagnostic accuracy. So now we have different cell block techniques. We have the clot and scrape, the cell block pellet alcohol fixation, the cell block pellet formalin fixation, the plasma thrombin method, the colloidine method, the Celient automated system, the histogel agar method, and the thermo-Shandon cytoblock system. So of course, different techniques have their own different advantages and disadvantages. So just please go over this. We go to the plasma thrombin technique. So how does it work? So cell block is prepared by adding cell button to plasma and thrombin. Cell material collects in clot. So the effusion sample, you centrifuge it, you decant the supernatant, and then you also remove the excess supernatant. You add the plasma to the sediment, then you stir, and then you add the thrombin to the sediment. So the clot formation, you put in 10% formalin and the clot into the paraffin block. So it's now ready for cell blocking. Next, we have the agar on other gelatin techniques, so concentrated sediment supported in agar or histogel. So cell pellet formed, then processed in paraffin. So the effusion sample is centrifuged, separating the supernatant and the sediment, and then you decant the supernatant. So you dry the excess supernatant over the filter paper so that the remaining sample in the tube will be the sediment. So add a few drops of molten histogel on the sediment and then you gently stir to permit mixing of the histogel to the sediment. And then you transfer the cooled and solidified histogel to the tissue processing cassette. So process for paraffin embedding. Okay, so the collodion bag technique, a concentrated sediment supported in agar or histogel, then cell pellet formed, then processed in paraffin. So how does it work? So you fill the tube with collodion, you let stand in warm place for 10 minutes, you puncture the top dried layer of the collodion, and then you decant collodion in other container to your reuse. You keep the Pyrex tubes inverted. So let the collodion coat on the wall of the tube. You should dry it completely and then store in a cool place. Okay, so add 10 ml of cell pellet suspension to the collodion bag attached to the wall of the Pyrex tube. Top up with saline. Then centrifuge at 1500 RPM for 8 minutes. So you discard the supernatant and then you loosen the collodion bag carefully from the wall of the Pyrex tube with the forceps. So you roll the bag along the length starting from the bottom without disturbing the pellet. So you wrap the rolled collodion bag with the pellet in a tissue paper. You keep in B5 fixative for 2 minutes. Soak in 70% ethanol for 2 minutes to wash the excess B5 fixative. So you put the tissue in a processing cassette to transfer to 10% formalin and process for paraffin embedding. Okay. Okay, so the tissue cloth technique. So you allow the cloth to form in the lumen of the needle tip. Then the cloth is then transferred to formalin. So this prevents the loss of the diagnostic material. So we have the procedure here. Okay. So next we have the Celient automated cell block preparation. So this method is already machine generated, so all you have to do is just insert the specimen or the sample into the machine. Okay, so we have the microscopic examination of the cells that is processed using the Celient automated cell block preparation, and also the cell block and then the cell cytology here. We have the Shandon cytoblock method. It uses cytocentrifugation to concentrate the cells in the cytospin. So already available kits of cell block cassettes and reagents. Okay. So sedimentation cell block technique. So these are the examples of cells in a microscopic demonstration using the sedimentation cell block techniques. So we have the squamous cell carcinoma, the adenocarcinoma, and the Hodgkin's lymphoma, and then the adenocarcinoma for the endometrium. So the protocol of the sedimentation technique, you transfer material to a centrifuge tube, you spin down to achieve a concentrated cell button, centrifuge set at 2400 RPM for 5 minutes, you pour off the supernatant, and then you add the buffered formalin. Okay. So you let the material set in the tube 30 to 60 minutes. Remove the hardened cell button with a metal spatula. The button is then placed on a histology tissue paper that has been moistened with buffered formalin. Okay, so special instructions for quality assurance. Cell blocks should be cut at 8 micrometers. If immunohistochemistry needs to be performed, it is noted on the QC sheet. So appropriate number of sections can be cut and ready for the immunohistochemistry stains. Cassette is checked by two cytotechnology lab technologists for proper labeling to ensure quality assurance. Cell block placed in formalin for at least 6 hours, documented on requisition with the timestamp. So for the PAP test, we have microscopic demonstrations using the thin prep, using the Papa Nicolau stain, and also we have for the cell block using the HNE or the hematoxylin and leucine stain. Next, we have the urine bladder washing, thin prep, and also the cell block. So that's all. Thank you. Okay.